Some people are of the view that COVID-19 is not real. There are many controversy theories that are being put out, but for Bishop Timothy Wambunya, his is a real first-hand experience. His travel to the United Kingdom saw him come back to Kenya and end up in the intensive care unit, battling for his life, peeping into the grave, but he ended up recovering. He lets us in on his sobering experience with COVID-19 and the troubles he endured from the time he jetted back into the country.
We find Bishop Timothy Wambunya outside his house. The lead cleric in the Anglican Church of Kenya's Butere Archdiocese is out enjoying the fresh air, where he does his breathing exercises to help increase his lung capacity. His family is wary of indoor interactions, for good reason. We therefore set up the interview outside, and he narrated his coronavirus journey to us.
2 months ago, I had traveled to the UK to support my son who was finishing his final exams. And then we traveled back to Kenya and arrived the day that the quarantine was introduced.
This was the mayhem that greeted Bishop Wambunya when he arrived back into the country. He says getting placed into a quarantine center was a process, a frustrating one at that.
When we were sent off from the airport to the first hotel of quarantine, they refused to accept us. Then we were taken to Nairobi University in Kibete. They refused to accept us. They took us to the government training college in Kibete as well. They refused to accept us. Eventually, some of us ended up at KMTC, and we ended up at Korat. And the center was a good center, enough space, so we were able to do our social distancing, and they looked after us very well.
After finally getting settled, he and his son spent 14 days at the center. At the lapse of their stay, Bishop Wambunya suffered a fever like none he had ever had before.
From the UK, I came back with my son, but he wasn't affected, surprisingly, and he's still fine to this point. But it hit me hard, very hard. And I also gathered that in the whole quarantine center, I was the only person who was positive. So that's another surprise as well.
He was then admitted to hospital, specifically Jomo Kenyatta University Hospital, where his woes continued.
The staff were very scared. They put me in a room, put a tape around it, and didn't give me any food or drink, and just left me there for about 2 days. So my wife had to keep calling, asking them whether they could give me food, whether they could attend to me. But I don't remember any attention being given to me. And that's where I lost some money, about $1,000 that I had in my pocket, and that was taken away. And I have no idea when and who took it.
He was then transferred to Aga Khan University Hospital, where his health deteriorated to a point where his memory of his stay there is faint.
So I spent the first 16 days in ICU, and I have no idea what happened to me, but I am told that as soon as I got there, they put me on the mechanical ventilator, the machine, and my body suffered very badly. My organs failed, my liver, my lungs, my kidneys, all failed, and the doctors had to work really hard to keep me alive while I was there during that particular time in ICU.
And indeed, his life was saved. He was declared COVID-19 negative and was discharged from hospital on Wednesday. His return home has come with a lot of change to the household.
The family has set aside a special room for me, so I'm not really interacting very closely with the family yet. I am undergoing a physiotherapy as well. My limbs are still not very strong. I still can't walk very far. And so all that will need to continue for the next few months to ensure that I'm fully recovered.
The bishop says that he does not know how or when he contracted the disease. The 55-year-old says he has no underlying conditions that would have aggravated his struggle with COVID-19. But he has some adapting to do with the new normal.
I always use the rails. It's a sort of automatic thing that happens to me, and there's a lot of rails that I touched in the UK. So it's possible I got it from one of those rails.
Being a man of the cloth, Bishop Wambunya is torn between his desire for communal worship and his fear of the contagion. And having battled the disease himself, it is not just another viewpoint.
We can do the hand washing, provide the equipment for that. We can wear our masks, but the distance is going to be a challenge. I think something can be worked out, but it still remains a very, very dangerous situation, bringing so many people together, and the likelihood of being infected or increasing the infection is very high. But I wish a way was found to reopen churches.
We leave Bishop Timothy Wambunya to recover. His hope is that he will get better and back to the pulpit. His message for now is that COVID is real and that Kenyans ought to take care of themselves so that they do not suffer as he has. Charity Mwangi, NTV.